Hey everyone, I am back. It's Dr. Hammond here with your mental health moment. For those of you who are brand new to Mental Health Moment, welcome, welcome. Today I am in the Tampa Bay area of Florida in the nice warm weather that we're having here. But thanks for those again who are starting to join here. It's Dr. Hammond here with your mental health moment. And what mental health moment is all about is different ways each week for us to talk about how do you become the best version of who you are so you can show up powerfully for yourself and for those around you. Really critically important, right? Hopefully, we're all working on some way to think about how can we become better versions of ourselves and how can we be healthier physically, emotionally, spiritually, mentally, right? For ourselves and those around us. So thanks again for those who are starting to join here today. Today, I want to remind you, if you haven't seen it, if you don't follow me on social and you haven't seen it, I will be speaking at the Get to Worthy Summit. So it is in the, you know what, let me try to change this banner here, but it's in the banner, gettoworthysummit.com. And I'm going to see if I can edit it really quickly here with if it's going to let me. Let's see. Okay, I'm going to put in the dates on here too, live as we're waiting for some people. But essentially, it's May 24th and 25th if you're in the Philadelphia area. I'm going to try to put that in here. I think it'll let me put it in here. May 24th and 25th for those of you in Philadelphia. Okay, for those of you in that area, I know some of you have asked me before, when will you be speaking and where? So let's see. Hopefully that'll show up there. There we go. Okay. So, so for those of you in the Philadelphia area or will be in the Philadelphia area towards the end of May, gettoworthysummit.com. I believe there's a couple days left for the early bird tickets, but I will definitely be there. I'm super excited about that conference. Basically, it's all things mental health and wellness. It is hosted by a dear friend of mine, Nate Evans Jr. So be sure to check that out. So for today's mental health moment, I don't know if some of you heard, but last year, back in 2023, the US Surgeon General declared a loneliness pandemic, right? So after COVID, obviously, unfortunately, we know what happened in the last couple of years with this global pandemic. But the US Surgeon General, what he did was he declared a loneliness pandemic because, especially after COVID, there understandably was a lot of issues with social connections, right? There was a lot of things happening with us. Of course, we were the globe, right? We were forced into quarantine, all that sort of thing. Well, a lot of anxiety continued to happen. A lot of disconnections happened, of course, during that time period, and it just kind of continued on into a couple years later for a lot of different reasons. So he declared a loneliness pandemic. So essentially, what that means is that a lot of us are dealing with social isolation. And I want to talk to you all about today about how do you think about your own social connections in your life. So actually, I'm going to go through. He actually, so well, it's like 70 some pages. So there's a whole advisory, if you will, a whole document that he published last year, the US Surgeon General, on this. But I just want to talk about three things for you to think about today when you look at your own life, when you look at your level of social connections, and when you look at your level of the quality of those connections, right? Because connections are really important for our mental health. So the first thing to think about is the structure. The second thing to think about is the function of the relationships in your life. So again, this is coming directly from the US Surgeon General last year. He did an advisory about social connections and how important it is. And what's the most interesting thing that I found in there was how we think you may think of social connections. Of course, it's important for your mental health. Of course, it's important for your mental health, right? To be supported by those around you. But what they were finding, which I thought was fascinating, is it also has a huge effect on your physical health. So the social isolation, like if if you're choosing, and I say that loosely, so a lot of things happen to us. It could be trauma, it could be depression, it could be anxiety, life experiences. A lot of things happen to us, but if if there's a choice and you say, you know what, I just don't want to deal with anyone. I want to be isolated. I don't want to be around anyone. I don't want anyone to support me. If you're in that, if your brain's in that mode, unfortunately, what they found is it really can affect your physical health too, to have that social isolation. They found a huge correlation with heart disease, diabetes, stroke, dementia, all these sort of major chronic conditions when we isolate ourselves too much. And I don't mean having a bad day, right? We all have a bad day sometimes, or maybe a bad week. We don't feel like talking to anyone. We want to be alone. That's not what I mean. I mean, choosing chronically to be away from people and not having any sort of social support. That's really linked to physical health issues as well, which is why I'm talking about this today. Because again, we tend to think that this only affects us emotionally, which it could also, but it's also emotional and mental and physical, and I would say spiritual too, just to be too disconnected from others. If you're just tuning in, let me know where you're tuning in from in the chat. And again, today, as we continue to take a deep dive this year into ourselves, right? And how can we be better versions of ourselves? Then again, I want you to really think about today socially, like the connections in your life, and really start to evaluate them. And I am definitely not here to tell you what to do with those connections you have. I think that's your definitely your personal uh responsibility and decision, your personal decision to say what to do about them. But the point is for us to at least examine them, right? Like the third thing on the list, the first thing to think about was the structure of your social relationship, meaning how many friends do you have? What does your colleague circle look like? Who's in your household? Do you have a lot of friends, a little bit of friends? Are you, do you have a family in your household or not? Who is around you, right? That's the actual structure. The second thing is the function of them, right? So are they supportive of you? Hopefully. Are they your cheerleader or are they toxic? Like which category are they in, or they're somewhere in the middle? Well, actually, I already got into the third part. But here's the thing to think about when it comes to the social isolation, because there's a lot of different reasons why we're isolated. For some of us, it is a choice. For some of it, for some of us, it might not be as much of a choice, but there's usually still things we can do to get around it, right? So let's say you're in a situation where you're like, man, I have a high level of anxiety, or I have a physical health condition that prevents me from leaving my house, or those sorts of things. Then let's think about like how else we can connect with others. Sometimes it might be just virtually for now, right? So if you're watching this or listening to this right now, you can be thinking about, how can I feel some other type of connection? Sometimes people feel connected by even listening to an inspirational podcast, for example. Like that can be at least a source of connection in some way, or watching something inspirational, or being a part of an online forum or a group. You don't have to necessarily be best friends with everyone around you that you're connecting with, but the point is to make sure that you be in supportive spaces. That's what's important. So the third part of, again, this is from the, like, straight out of the US Surgeon General's advisory from last year that he did surrounding social connection. The third part to think about was quality. So the first thing was the structure of these relationships or connections in your life. The second was function. And the third is the quality. So again, it's funny. I usually see things on social media wall that says, are people, it says something sort of like, are people a drain or a faucet? Meaning is like when you're around certain people, are they draining to you? Are they just zapping all your energy and taking all your energy away? Or are they a faucet? Meaning they're providing something, inspiration, motivation, support. How can I help you? Like what level of help, if you will, or what level of satisfaction do you have in those friendships, or those, if you're working with the coworkers or with your uh family members, friends? Like think about that, because it's really important. Again, I'm not here to tell you what to do with your friendships and relationships, but um it is important to recognize, do I need to adjust my time that I spend in certain places with certain individuals, if that makes sense? Meaning spending more time with people that energize you and uplift you and motivate you and support you. And maybe if there's certain individuals that are more toxic or more negative or just pulling you down or being a drain, that sort of thing, to think about maybe adjusting how much time you're spending with that individual. So let me know in the chat here if you can make a commitment to really think about. So those are three things again from the US Surgeon General. But let me know in the chat if you just say like a quick yes, if you're willing today to make a commitment to examine some of the social connections in your life. So just be like, yep, I can. If you're just like, nope, I'm too overwhelmed, it's all good too. But just, kind of type that in the chat. I love when this community really thinks about like what else can we be thinking about in our own lives. I do want to say though that this no mental health moment actually, but this is definitely not a substitute for therapy by any means, listening to any of these lives. So sometimes you can start to think about certain relationships or friendships or coworkers or whomever it is, and it might be too overwhelming for you to really assess, like, is this healthy, is this not healthy? And sometimes you need the help of a mental health professional or a life coach or someone else from the outside who's objective to look into that situation, which is okay if you need that. So if that is the case, then make sure that you're reaching out to someone, or even, I mean, it could be a trusted friend or family member, but someone else that is outside of your situation to help you examine the relationship, because we don't always see, because we live within our own lives. We are obviously biased of the events that we experience, but someone that is, again, more objective, which is not always our friends and family. Sometimes it is a mental health professional, but someone from the outside can see things a bit more clearly and maybe can help you navigate that space. Again, this is what Mental Health Moment is all about. For those of you who are new to Mental Health Moment, it's examining each week for you, what is it that you need to be thinking about and how can you make adjustments. So after you do those three things, looking at the structure, looking at the functions of different relationships in your life, and looking at the quality of them, then once you know those answers, then you think about what steps you need to take. And for some of you, again, you may be like, you know what, Dr. Hammond, I'm in a great space right now. I'm in a really I have a lot of good quality support around me. Or some of you may be like, I think something is lacking with my friendships or with relationships or with coworkers or wherever that lack may be. And sometimes you can fulfill the lack of support in like the same category. So let's say you're like, man, I don't feel connected or supported enough at work, for example. Sometimes you can fill it, if you will, in that category, but sometimes you can't. So there's another category of support that you may need because you might not be getting the support you need at work, let's say. Right. And that's okay. So for some people, so for a lot of organizations I've talked to, actually, that happens a lot of times where they either don't feel supportive in the workplace and they find other communities that provides that mental health support that they need to be able to function better on the job. For example, the same thing with friendships. Maybe it's, you're like, man, I don't have the friendships that I would want, but my family makes up for it. Or I don't have the family members that I would want to support me, but I have friends that do. So you, again, it doesn't have to be equally in each category of our lives to be supportive. It just has to work. That combination has to work for you, right? That's what's important. Yep. I do want to, put a big asterisk on this today, that I know I'm talking about social connections and isolation and that sort of thing. And some of it is more controllable than others when it comes to isolation, because that comes from a lot of different reasons. So I appreciate you sharing, what, this comes from a place of trauma, and it absolutely can sometimes. And if that is the case for you, whoever you are listening to this, that maybe you're in a place of trauma and you need additional healing to help with your feelings of isolation. Maybe you're choosing to isolate, or maybe you're isolating because of life experiences that happen. Then again, I would encourage you to think about, what steps do I need to take to work on resolving that? And it's usually not an overnight process. Actually, it's 99.9% chance it is not an overnight process to heal from any sort of trauma. But again, with the help of a mental health professional or with supportive people around you, you can start taking the steps in that direction to live a happier and more fulfilling life. We're all at different levels when it comes to our mental health resources or our tools. Again, as I always say, this is a journey for each and every one of us. Some of us are at the starting line for examining our lives, for unlearning all the things that maybe we were taught in childhood about mental health and wellness and being okay with being okay. Like, you're allowed to be healthy. You deserve to be happy. You deserve to be emotionally healthy. You deserve to have joy. You deserve all those things. So some of us are at the starting line, and that's okay. Some of you are like, I've been rocking with this a little bit, this self-care thing. I think I'm trying to put myself first. I think I'm trying to get better, be a better version of who I am. So you're like, okay, I just started a little bit. I'm trying this out. And some of you are like at the advanced level. You're like, you got everything going on. You're good. You're in maintenance mode. Right. And here's the thing, no matter where you're at in this journey, it is perfectly fine wherever you're at. The fact that you're listening to this right now is amazing. The fact that you're watching and or listening to this right now to be like, I'm going to tune in just to see, like, what do I need to work on this week? What are some things that I can start to think about right in my life? And again, excuse me, and again, for mental health moment, there's so many tools over the years. There's so many tips and strategies that I've offered, but again, I want you to do what works best for you. But again, if you're just not tuning in, essentially today what we've been talking about is for you to take the time to start to examine your social connections in your life, right? So whether it's if you're in a relationship, whether it's with your kids, your grandkids, uncles, family members, people at a place of worship, coworkers, neighbors, whoever it is around you, whoever it is around you that is that you feel like is supportive in your life, and or also the individuals who you're like, man, I don't feel as supported from in your life as well. But just taking an inventory and asking yourself again, what do you need? Like, what is the next step? A lot of times, well, a lot of people I've talked to over the years have said, I'm struggling with clarity. I don't know where to go. I don't know the next steps. And sometimes we get very overwhelmed by that. But one of the things that you can try, I know it's hard. I know it's hard. But one of the things that you can try is to get into a place of silence, because we have a lot of noise around us, meaning we have a lot of people telling us a lot of things. If you spend any time at all on social media, I feel like every day there's someone saying something of what to do and how to act and how to be and all those things. It can be really overwhelming. But if you take the time for yourself, give yourself permission to work on the healing process and give yourself permission to be in a silent place, and whatever it is for you, whether it's quiet time, whether it's prayer, meditation, whatever you want to call it, you can work from there to really start to discover, like, okay, here's the issue, like, here's what's going on with these connections in my life, and let me think about what is the next step I need to take. And again, if you try all those things and you're like, man, I'm still overwhelmed, I'm not sure, I'm struggling in a particular area, then again, which is okay, you might need to reach out to someone else, right? A professional that can help you clarify and get some of those answers. So actually, I'm going to be wrapping up here in a second. I did want to remind you before I hop off, though. Excuse me, for those of you who tuned in a little bit later today, May 24th and 25th in Philadelphia, if you're in that area, will be the Get to Worthy Summit. So I'm super excited about that. It's hosted by a dear friend of mine, Nate Evans Jr., who is outstanding human being. And it's going to be a great summit. It's about all things wellness, about mental health. How do you grow as a person? There's a lot of different panels, a lot of different speakers. I'm excited to be there. It's going to be outstanding. But I will be there May 25th, actually, in Philadelphia. So you can register now. There's a couple more days left for the early bird tickets. So you can get a discount, because who doesn't love discounts? All right. And then, of course, you can register later too, but it'll be regular price. But gettoworthysummit.com. It's in the banner here. If you're in that area and you want to go to that. So There is that as well. So if you all need me though, you can always reach out, drnekeshiahammond.com, or you can follow me on any social media platform, dr.hammond on Instagram or LinkedIn, Facebook, or X. I always want to say Twitter, formerly known as Twitter. But you can connect with me on there. I'm usually sharing some sort of mental health resource on there. I don't think I'm speaking in Seattle this year and then I end up in Seattle. Who knows? But I will definitely let you all know. Yes, I'll let you know as much as I can where I'm speaking at when it's open to the public. So I just spoke today for another organization, but it was a closed event only for that company. But when it is open to the public, of course, I will let you guys know because I will be traveling back to my traveling schedule this year, speaking at different events, which I'm super excited about related to mental health, related to burnout prevention, and also with my book, which I'll tell you guys more details about coming up soon here. But again, thanks for tuning in today to Mental Health Moment. Be sure, as I mentioned, to really think about those social connections in your life, taking the inventory, asking yourself, is this supportive? Is this, toxic? Is this okay? Do I need to make changes? What do I need to do? How can I best support myself? How can I best make myself my number one priority? And thinking about your health emotionally, physically, mentally, and spiritually, right? And I wish you all well. Have a great week. Be blessed. And I'll see you all next time. Bye, you guys.